It's EULAR 2023 coming to you live from Milan. Milan's quite an interesting city. It's elegant, it's modern, yet it's kind of quaint. I've learned that it's actually not a place you come to for the pasta, but otherwise the cuisine is really quite good. So, what can I tell you so far? It's the first day of EULAR 2023. It's a slow beginning. You know, when you go to these meetings, the first day, thankfully, is slow. There's a lot of symposia, a lot of overviews, not a lot of raw data being presented, but there was some that I'll go over. And a lot of that's by design. I think that, you come to these meetings, you got to learn a whole new convention center. It's 8 million miles walked, of course, every day. I gave up wearing dress shoes to these meetings. I wear my Brooks running shoes. I mean, it's the only thing that you can do. So a lot of walking, a lot of navigation. You got to go to, the South Hall, the North Hall, the auditorium, the meetings and breakout rooms. It's overwhelming. So not much going on the exhibit floor with the companies. They're just starting up. They do have posters here, although they're very green, meaning there are no paper posters. There are no poster boards. There's rows and rows and rows of 46-inch TV sets or flat screens that you can look at posters that way. Not a lot of posters presented today. So I think it's off to a good start. Milan's a great city. It was easy to get into. The food so far has been great. The people have been great. Really glad to be here. This week on RheumNow, I want you to look for our faculty. They're going to be writing reports and tweeting and doing videos. We're going to end each day, not today, the first day, but starting tomorrow, day 2, day 3, day 4, we're going to end with a daily recap with the faculty reviewing the highlights of the day. So I'll be writing about that, but I'll tell you about 2 abstracts I saw today that had to answer the question, does colchicine work in osteoarthritis? And the first presentation was from, I want to say, Australia and Austria. It was a multi-center study. It's the low-dose 2 trial, the low-dose colchicine 2 trial, which was published, I think, in 2020. About a 5,400 intervention trial in cardiology, looking at whether colchicine, the anti-inflammatory, would lower MACE events and other untoward cardiac outcomes. It had a composite outcome. It was like major cardiac events and MI and something, 4 definitions. Anyway, in that trial, colchicine was significant against placebo. And so if you were on a placebo, I think the event rate was like 7%. And if you were on the colchicine, it was like 3%. That was significant and meaningful. And although it was a really well done trial, it was in the New England Journal, I don't know that there's a whole lot of colchicine going on in the cardiology world other than for chronic idiopathic pericarditis. But nonetheless, maybe it takes time for those things to happen. Anyway, they looked at that data and they kind of resurrected what happened in the CANTOS study. As you know, another anti-inflammatory intervention trial with an IL-1 inhibitor, canakinumab, in heart cardiovascular risk patients only, looking at heart outcomes. And they showed in that trial that there was less need for joint replacement, knee replacement. So they said, well, we could do that with our patients. The problem with this study was that they had no data about the patients and arthritis and immobility and pain. None. So this is a sub-analysis only looking at whether after this trial was done, patients had undergone hip or knee replacement. So I remember that they could enroll patients from age 35 to 80. Mean age was about 62 years of age. About 2,700 patients in each group. And they were taking 0.5 of colchicine a day. Not even like standard anti-inflammatory doses, 0.5 a day. And when they looked at the need for future hip and knee replacement, it was significantly lower in those on colchicine. It was like 31% lower. The hazard ratio was 0.69, and that was significant. But 8% of the population that they included had gout, and so when they excluded those people, it was still significant. It was now like a 40% reduction in risk of hip or knee replacement. They also then went ahead and excluded the people who had hip and knee replacement within the first 3 months of the study ending, suggesting that maybe it wasn't long enough and whatever. Anyway, even removal of those patients didn't change the data. It was still about 61%, 0.61 hazard ratio, or 39 to 40% reduction. This is a mind blower. This is a head scratcher. I don't know that this is a trendsetter, and that's because they made the claim that there's about a dozen studies, some of which showing actually they showed something like 8 out of 10 or 10 out of 12, showing a positive effect when you compare colchicine to either an active comparator, acetaminophen, or a placebo comparator. And that's not my interpretation of that literature. And I later ran into Dr. Joel Block, who, as you know, is from Rush, and he's the osteoarthritis maven. And I asked him about the data on colchicine. He said it's null. It's basically, it's never any better than the comparator. And there's always a few outlier studies. And, I asked him about this study, and he said he hadn't had a chance to review it in its entirety, but he had concerns about its design, even though the analysis looked good. Well, interestingly, at the session on osteoarthritis, where they also talked about denosumab being protective in patients with EOA, they had another colchicine in hand OA study. This is a smaller trial. I think it was 50 patients in each group. They gave them full dose BID colchicine, and absolutely no effect on pain. Yet, the colchicine group had more GI adverse events, as you might expect. In the low-dose code 2 trial, both for the heart patients and for the arthritis or joint replacement outcomes, there was no difference in adverse events. So what do you believe? Do you believe colchicine, the drug that used to cost nothing, could actually be preventative and should be used more in OA patients? And I don't think I'm ready to do that, even though it's an impressive report. It's currently in Annals of Internal Medicine if you want to look at it. Or do you believe the plethora of other studies, often those studies having flaws in design as well, but most of them showing no difference compared to a placebo or an active comparator? Anyway, I thought that was the rock star beginning to EULAR 2023. Tune in for more great videos from the RheumNow faculty. Follow us on Twitter. Enjoy yourself.